Good morning, everyone. My name is Alex Sorotsky. I am a public health educator with the Washington Poison Center.
And my name is Megan King. I am another one of the public health educators at the Washington Poison Center. This is our first session of our overdose prevention, harm reduction, and treatment series. So over the next 2 weeks, we are going to open dialogue. We're going to destigmatize a lot of the intentional and unintentional factors that can lead to overdose. So you will be hearing from a lot of our own Poison Center staff, as well as some of our really amazing partners who are offering resources and help to communities all across our state. So a little bit of housekeeping before we really get going on this session. Please feel free to ask any questions that you have in the comment section on YouTube or Facebook, whatever platform you're watching on. We will do our best to pop those up on the screen and answer them throughout the stream, but if we miss any of them, we will be sure to follow up with you later on.
So we are all meeting today to kind of ground ourselves in the series and set up some of the themes that we're going to be covering in the future sessions throughout these next 2 weeks. So to help us do that, so it's not just all Megan and I talking at you, we are so excited to be joined by our medical director, Dr. Scott Phillips, and our data analyst and one of our CE spies, Gordon Morrow. Thank you both so much for joining us today. And can you each tell us just a little bit about your positions with the Poison Center? Dr. Phillips, starting with you.
Well, first of all, I want to thank Megan and Alex for organizing this fabulous awareness 2-week session. It's taken a lot of effort and a lot of time, and I'm so pleased that we were able to do this. So I'm the medical director of the Washington Poison Center, so I really deal with all things medical as a way to think about that, and that has to do with making sure our advice is up to date and accurate, providing guidelines for our poison specialists to work from, provide educational sessions such as the one we're doing today, and just general clinical oversight.
Excellent, thank you. Gordon, how about you? You have kind of a cool split role with the Poison Center.
Yeah, thanks for putting this presentation together as well. Yeah, I work, I kind of have 2 roles at the Poison Center. My primary role is as a poison specialist. I'm a pharmacist by training, and I work in the call center answering calls and helping manage poison patients. And then my secondary role is as our center's data analyst and data specialist, and I provide the mechanism by which we can retrieve and analyze our data to hopefully get some clinical recommendations out of it.
Wonderful. Thanks for providing that overview. So kind of setting up people to understand what you both do. So now we can actually dive into our topic for the next couple of weeks, overdose. So I think people are probably a little surprised that a Poison Center is focusing on this topic. I mean, we hear so often that people think of Poison Centers as a resource for kids who have gotten into something that they shouldn't have gotten into. But overdose is really important to us at the Poison Center. So Dr. Phillips, can you tell us a little bit about why we decided to host this series that's entirely dedicated to overdose?
Yeah, it's a really important topic to us, obviously. And, an overdose is essentially too much of some substance that typically results in some undesirable effect. It's kind of a broad topic, but this is really important because oftentimes these effects can be quite harmful and even life-threatening in certain instances. Now, we always hear about some reports and statistics of people that are dying from certain overdoses that we might see. You see this in the news all the time. But in our world, that's actually a very uncommon thing to occur. And Gordon is certainly the expert in the data here. But the vast majority of calls that we get and advice that we give have to do with medication management, with incorrect dosing of medicine or extra dosing, or people that intentionally take too much of something. And I think this is really important because, our mission at the Washington Poison Center is to prevent and to reduce harm of poisonings and overdose. And that's really through our expertise, our experience, our collaboration with each other, and most importantly, through education, like the sessions that we'll be doing the next 2 weeks.
Thank you very much for that, Dr. Phillips. Now, Gordon, because you are a data specialist, you have a particularly nuanced view on our call categories. So could you walk us through what some of the different types of overdose calls we get?
Sure. Yeah, and as you know, as Dr. Phillips mentioned, any time you exceed the recommended or prescribed dose, that is technically an overdose. And I think the term is something that has a bit of a stigma attached to it. But at the Poison Center, even if you accidentally take a second dose of your Tylenol, that's an overdose, and it doesn't necessarily mean there's anything intentional about it. But we do have to categorize all of the calls we get into various sort of categories as pertaining to the intent of how it happened. What was the nature of the actual ingestion? And a lot of times this depends on the age of the patient. We have categories, for children up to 6 years old, we basically categorize them all as what we call an unintentional general, and that the child is not old enough to understand what's going on. We also have other unintentional categories, including misuse, and that can be something that someone of any age can do if they just accidentally use the medication incorrectly, or they accidentally ingest a cleaning product thinking it's something in if it's in a water bottle or something. And then we have some categories that pertain more to intentional ingestions, basically doing it on purpose. And that would be people who are maybe taking excessive doses of their medication to treat pain, or taking a medication for something that it's not necessarily approved for, but maybe something they heard about on the internet or something as a cure for a different type of disease. And then we have some of the categories that are probably more expected that we would deal with, things like people potentially abusing excessive doses of medications or opioid medications. And then probably the other more significant one is self-harm and intentional ingestions, where people are actually trying to harm themselves. So we manage and handle all sorts of intent, ranging from small children accidentally doing things all the way up to adults who are trying to actually hurt themselves.
So, Gordon, do the reasons for overdose tend to differ based on someone's age? Like you mentioned, kids younger than 6 are typically going to be unintentional general exposures, but are certain age groups more prone to specific overdose reasons, or do we see one reason more often in certain age groups?
I think, well, as we start to, look at the different ages, as we mentioned, anybody who's up to 6 years old is just going to get categorized into they're just not old enough to know a difference. Once we reach, adolescent age, children or who are, in their teenage years, even nowadays, possibly in their preteen years, 10, 11-year-olds, we start to see intentional types of ingestions, including self-harm ingestions. But probably the most prevalent reason in that age is more of a misuse or possibly even an abuse category, although we are seeing some trends in this area that are concerning, that I think we'll mention in a little while. Adults, your typical adult, we see the most variability here. It can be many different reasons. We have to remember that we get contacted about certain types of exposures where we may not be seeing, exactly the whole number of what's going on out there. So sometimes we see maybe more serious ingestions in adults, whereas a lot of the less serious ones we may not know about. But we definitely can see the whole gamut there. And then in the older age groups, we tend to see more errors, therapeutic errors, patients taking the wrong medication by mistake, or possibly, unintentionally taking excessive doses, or their morning dose again in the evening, those sort of things.
Great. Dr. Phillips, do you have anything to add here?
I don't think so. Gordon is certainly the expert when it comes to data here. And I would say that one thing we are seeing more in older adults is it tends to be primarily misuse, but there is an increase in recent times of more intentional ingestions by the older population. So that's something we're also aware of and dealing with. So, and in addition to that would be drug interactions, how two drugs interact with each other to cause problems is also not infrequent in adults just because they're often on many, many different medications. So.
All right, thank you both for walking us through that. And for folks who are watching this now or watching the recording, please, please, please remember that we do take calls for adults. We take plenty of calls for kids, but for adults as well. All right, so both Dr. Phillips and Gordon, you've worked at not just the Washington Poison Center, but other poison centers for a number of years throughout the United States. Just what are some trends that you have individually noticed over time, starting with you, Dr. Phillips?
Well, I think perhaps the biggest thing that has happened in the 30 years that I've been involved in toxicology, or a little more now, is social media has played a huge role in promoting misuse at times. It's not always for proper education. And of course, our platforms like we're doing today on social media is to provide some accurate, good information, good resources, and that kind of thing. So I think social media has played quite a role. The other major thing I think that we've seen is that many of the medications, both prescription and illicit medications, is the potency of those medications. And many of those are quite potent that we're seeing, for example, fentanyl is so much more potent than other opiate drugs that we're really seeing quite a bit of destructive harm from that drug as an example.
Thank you. Is there anything you'd like to add to that, Gordon?
I think I would just definitely echo a little bit of what Dr. Phillips said, especially about the sort of the social media as being a driving force in some of these things. We see these trends pop up on social media, and then we know right away that we're going to start getting calls, and we almost invariably do. And so I think probably the one other thing I've noticed, over my time is in the last, 15, 16 years is just the rise of the internet as a source of information for the public. And, I get a lot of my initial calls from people are people who have already done some research on the internet by the time they call us now. Whereas at the beginning of my career in this area, that was rarely the case. So now not only are we sometimes having to provide recommendations and information, but we're actually having to undo a Google search, so to speak. And because there is a lot of bad information out there. And so it's always nice when we're called first, but this is definitely something that I've noticed that we have to combat a little bit of the bad information that's out there now. And that's just basically a new skill set that we've all had to develop.
Great. That was an excellent overview. And I really appreciate you both talking about the social media challenges. I was just looking through some of our resources, and I think we're coming up on a year exactly that we issued a press release on the Benadryl challenge, which was one of those social media challenges that we were hearing about. So we would like to end this stream with a set of questions that we're going to ask every one of our presenters during the series. So this first question is, what is one thing you wish everyone knew about overdose? Gordon, we'll start with you.
I would just sort of reiterate that an overdose sort of a loaded term, and it is something that, there is a bit of a stigma attached to that word. A lot of people are afraid to look for help if they've either intentionally or unintentionally overdosed. And I would just say that, here at the Poison Center, we're not in the business of making any judgments as far as that, and that sort of the patient care is our focus.
Perfect. Thank you. Dr. Phillips?
I think the one thing I really want people to realize and understand is that 1-800 number that you see behind Alex is a national number, and it gets routed to our Poison Center as well. But we're here to guide people, to provide information, to provide education, to answer questions, and hopefully through this education process, alleviate a lot of medication mistakes and misuse. I think that's a big focus that we try to rely on. So that 1-800 number, no matter where you are in the United States, you'll get a Poison Center in that region.
Awesome. Thank you both. And I love that messaging that we're here to help. We're not here to judge. So there's never any shame in contacting the Poison Center. I promise you, Gordon and the other call takers have heard weirder stories. All right. So after listening to you here today, engaging in some of the other sessions during our series, what is one action step that you would like our viewers, like our audience, to go ahead and take, starting with you, Dr. Phillips?
I would say the one action step is to have our 1-800 number programmed into your telephone. So you don't have to think about it. You don't have to worry about it. It's right there under Poison Helpline.
Perfect. How about you, Gordon?
Well, Dr. Phillips stole mine. So I would just say use that number before you go to Google.
Perfect. Great recommendations. So we have obviously engaged in a lot of hard topics today, touched on a lot of really difficult scenarios and situations. So to round us out on a positive note, can you share with us what gives you hope in your work? Gordon, we'll start with you.
I think, I think probably right now, I would say sort of the motivation and professionalism that I see in the community of people who work at poison centers and in the field of toxicology in general. Our center has trained several brand new specialists who were right out of school, and I'm just really impressed by their ability and their motivation. Nobody goes into the field of toxicology to make money, but I think there are a lot of dedicated people who are here to provide good information and have patient care as their primary focus.
Dr. Phillips?
Yeah, I would also say that, we are really blessed with both fantastic poison information specialists, but also our educators. And I think that's one of our main goals that I'm really happy and excited about is providing education, providing information, and turning the social media foe into our friend and using that as a way of reaching everyone that we can to make them aware, make them know that the Poison Center is non-judgmental and friendly and easy to access, and we're here to help you free of charge. And there's not many other things that are available that way today that are really scientifically based and sound. And we have quite a passion for this mission that we have.
Wonderful. Thank you both so much for walking us through that, for joining us, for providing your expertise, and for the work you do. And a big thank you to the audience, to folks who are watching now, to folks who are watching future recordings. Keep in mind, all the sessions over these next 2 weeks are free. They're publicly available, and they're recorded. So if you can't miss or you can't attend the actual scheduled time, you can catch it right after. So even though we're wrapping up this stream in just a moment, keep throwing any comments or questions in the comment section there, whether it's on YouTube or Facebook. We'll do our best to follow up whenever we can. Megan, is there anything you'd like to throw in before we log off?
Just a big thank you again to Gordon and Dr. Phillips for joining us today, and for all of you for tuning in and watching this live or watching the recording. I did just put the link to the rest of the lineup for the series, so please attend the rest of our social media live streams. There are also a bunch of Zoom sessions that you can watch either by registering for Zoom or watching on TVW's website. So I'll put links for that there as well. And thank you all. Have a fantastic rest of your day. And I think we're going to go ahead and end the stream. Bye, everyone.
Bye.